Well, hello, everyone, and welcome to the Tenpenny Files. I'm your host, Dr. Sherri Tenpenny. Here on the Tenpenny Files, we dive into vital and often controversial discussions on topics that will challenge what you've been told and reveal what's been hidden. Are these compelling conversations make you think, inspire debate, and hopefully inspire you to action? Join us here every day at 3 p.m. Eastern Time, where you can hear from authors and documentary filmmakers who have something important to say but have often been censored and silenced. Our conversation today is with Twila Brase, President and co founder of Citizens Council for Health Freedom, CCHF, a patient centered policy organization established in Minnesota more than 20 years ago to protect patient doctor freedom. Her 8-time best-selling award-winning book, Big Brother in the Exam Room: Dangerous Truths About Electronic Health Records, written in 2018, is as timely and as important as ever. Twila is a regular with us here on the Tenpenny Files because she's always got so much important stuff to talk about. We've covered topics such as the Real ID, Medicare Advantage, and other critically important healthcare topics, which we're going to talk about more again today. So, Twila, welcome to the Tenpenny Files. Thank you for joining us again and for being a regular monthly guest with us.
It is always good to be here. Thank you.
Oh, you bet. Wow, with so much happening in healthcare almost on a daily basis, we don't even know barely where to start. We could talk for 5 hours on this. Start with the great care plan. Trump said that he was planning a meeting with 14 health plan companies. Did that happen? Or has something bigger and broader than that even happened?
Well, I guess I would say that he introduced his The Great Healthcare Plan proposal on the 15th of January. And if you look at it online, it is just the cover page and then 4 issues on the back with a few details, which aren't a lot of big details. But he did introduce that, and that was before his meeting with the health plans. I think there's been some people who are excited about what is on there, some people who wish that there was more on there than there is. And then, of course, there's the people who just don't like, what anything that he does, or they don't like pieces of it. I think one of his big things is to try to get dollars back into the hands of individuals. And I will say that, we put out a press release on this, and we said, he did some great things, this idea of moving healthcare dollars into the hands of healthcare people to make choices and to make cost benefit decisions with their own dollars, to expand, who has the HSA, who can have an HSA. Really, it just needs to be disconnected from health plans so that anybody, including the mom who's taking care of her 4 children at home, or the homeschooling family, or whatever, where somebody isn't working, they need to be able to have a health savings account too and get that tax benefit. So he has things like that, and they're more over-the-counter medications. The thing that we really didn't like was that everything is still kept within the health plan arrangement of the Affordable Care Act. Like, he wants to bring the prices down, and this is great. But it looks like he's saying that he's not going to fund something, but it looks like he'd have to fund it to get more people's prices affordable. And so then you just have more government. I know I got a text from somebody right after she saw that he had released this, and she said, I just wish that there was less government. Couldn't it be without government? And so, he really, the plan stays within the health plans, it stays within the Affordable Care Act structure. And really, what needs to happen here is that we are allowed to have non-health plan real insurance. The major medical policies that you have a contract with as an individual, where the insurance says, for catastrophic and insurable events, we will pay you this much money. Would probably have an end point of $2 million or something, right? But it's a contract, and they agree to pay you. End of story. They don't say things like, well, I don't know if that's medically necessary. Let's prior authorize it. Let's see if there's other medications you could use instead. These are the only medications we let you use. That's the health plan. Real health insurance just says, we have a contract here. If this happens, we pay you the money, and they do. And so that's what we wish was in his great healthcare plan. And that would have made it like the greatest healthcare plan if he actually would free the American people from the corporate version of socialized medicine that is just consuming so much money and has so much power over what happens in the exam room, the doctors, the patients, the whole kit and caboodle. That would have made it a truly, greatest of great healthcare plans. But I don't know that his advisors are giving him that information. There's a lot of people who, in the conservative realm, that think that it's conservative to have the health plans in the position that they are. They call it private insurance. But it's not insurance because it's prepaid health care. It's not insurance because they have to cover pre-existing conditions, which would be like, telling you that, oh, okay, your house is on fire and you don't have homeowners insurance. Go get it now. Your house is on fire. And requiring that insurance company to give you insurance against a house that is currently on fire. That's what covering pre-existing conditions is all about. So that's not insurance. So we don't have insurance today, and we'd like to bring back real insurance, and it would be affordable. It would be patient-centered. Nobody would get in the way between you and your doctor. You could go anywhere, no prior authorization. So that's what we would have liked to have seen in the plan, and we didn't. But I don't know that his advisors who think that these health plans that can limit your care, they actually think this is the market, but it's not. It's been put in place by the Affordable Care Act, and that's why they have all the control, and that's why you have only them as a choice because of Obamacare.
So CCHF sent Trump and Secretary Kennedy 15 questions. Uh,
Mhm.
do you think that what he's planning, that he even saw them, or that they've taken your considerations, your questions into consideration?
Well, here's the deal about that. So we heard that President Trump said that he was going to call all the health plans in and try to convince them to take the price of health insurance and to drop the price of health insurance, to make insurance, which is not really insurance, right? But to make prepaid healthcare more affordable, this health plan coverage. And so, in anticipation of that, we thought we would send him some key questions that he should ask. And the reason why we think that he needs some key questions is because, he has publicly said that healthcare is complicated, it's complex. And it is, but only because of the health plans and all the third-party payers. If it was just like anything else that you would buy, it would be pretty simple. But so we thought we would send him some questions to ask the health plans. Well, he first mentioned this in the middle of December, and then on January 6th, he said that there were 14 health plan companies that he was going to call I think into his office, for a discussion. I don't know that for sure, but anyway, there are 14, and he wanted to pull them all together and ask some questions. So on the 6th, we sent him a letter that very day when he said that with our questions because we'd been working them up since the middle of December. And so we sent those questions to him, and then we tried to find people who might be able to get closer to the president. Because if you send something by mail, if you can't find an address to send it, by email, then it's going to be a month or more before it would even have a chance of getting into his hands. And we wanted it in right away. So we contacted some of the people that we know, and we're trying to get these questions into the hands of both RFK Jr. as well as President Trump, because we figured if we could get it into RFK Jr.'s hands, he could talk to President Trump if he liked our questions. Anyway, we did get somebody who contacted us who is really close to RFK Jr., no names here, but and this person said, I really like your questions, but you need to have footnotes for everything that you say. So, and so we did that. And then we handed that back to this person. And we understand that this person has probably emailed them directly to Secretary Kennedy. We cannot say that for sure. Nothing is for sure. But we are hoping that that will influence whatever happens when he finally brings these 14 companies together. Now, President Trump usually says something and means it. So we believe that this is still going to happen. And we believe that our questions really align with some of the things that he's been talking about, but also probably things he doesn't have any idea about. And so, just to give you an idea, so they're online. It's part of our press release. People who are listening to you can go to cchfreedom.org, our website, cchfreedom.org, and they can look at those 15 questions and they can see our endnotes, like where did we get the data that we have, or what's our resource for the data that we have in the 15 questions. And so like the first one just says, it's called ACA windfall. It says Bloomberg government reported in 2010 that the Affordable Care Act was a $1 trillion windfall to health plans over 8 years. And then we ask if that windfall, part of that windfall was because Americans were forced to buy their product, the qualified health plan. And then, we just go on from there with some, statistics about the amount that taxpayers have paid to health plans over the years. Um, and then we want him to ask questions of them, such as, do you support giving patients control over healthcare dollars through HSAs? Do you support tax equity, where employees get the same tax benefit as employers in order to purchase their own coverage? Or do you support returning to individual catastrophic medical indemnity policies that pay patients directly? And the fourth one, do you support Medicare dollars flowing directly to patients? So we have, and that's just one of the questions called dollars to patients, all the different ways that dollars could go to patients. So there are 4 questions that could be asked. So we really hope that by hook or crook, this will get to President Trump for that time. The fact that the person who contacted us said that this person really liked those questions, but really just wanted all the end notes so that the president and RFK Jr. and his staff and whomever can say, oh, I see, oh, I see, and can actually see the facts that we present as truth.
Well, and then they can actually have a staff member pull
Mm.
those references too. So instead of having like 2 pages of questions, they can have this much of references and print all those things out, which just gives it, more visual power. It does,
Right?
to change to that. So that's really, really cool.
Yeah.
Over the course of, I think you and I have been doing this for almost 3 years now, that you
Hmm.
come to our show once a month. Over the last 3 years, we've talked a lot about Medicare Advantage, and
Hmm.
the downsides and the deceptions of Medicare Advantage, that seniors just think, oh, it just sounds so cool. And they have these, cool little pictures of all these people that they're so happy, on their website. Well, on January 1st of this year, things really changed from traditional Medicare and something to do with Medicare Advantage. What happened at the beginning of this year?
Yes, so this is going to have real implications for doctors and patients, and nobody yet knows exactly how it's all going to shake out. But the CMS, which is the Centers for Medicare and Medicaid Services, announced, I think they maybe announced it in October. I could be wrong, it might have been August, that they were going to do a 6-year pilot project in 6 states. And they are going to bring, starting on January 1st, prior authorization to original Medicare. Now, for your listeners to understand the difference between original Medicare and Medicare Advantage, I think that's something I need to explain first. So, original Medicare is like the freedom version of Medicare. So, you can go to any doctor you want to, you can go to any hospital anywhere in the country. Everything is available to you. There's no prior authorization. If the doctor says that you need it, you will get it. I mean, there's a few little things, but for the most part, if the doctor says you need it, you will get it. Medicare will pay for it. No, they won't pay well for it because they never do, but they will pay for it. Um, Medicare Advantage, however, is the health plan version of Medicare. So the government pays these plans a certain amount per enrollee per month. And then the plans by law are allowed to keep all that money, except when you need medically necessary care. So they get to decide what medically necessary means. They get to decide whether it's experimental. They get to decide which drugs you can have and which drugs you cannot have. That's actually a problem in original Medicare too, but it's more of a problem in Medicare Advantage. And so a lot of people say, well, Medicare Advantage is wonderful because, I don't pay anything for a premium. Okay, but consider the cost when you actually need care, when you actually aren't healthy. Because if that happens, suddenly you will run into prior authorization and you will find out that they don't allow you to go to any of the cancer centers in the country. That's not in their network. You'll have to find a doctor nearby for cancer treatment, even though maybe you've got a rare cancer or maybe you just want to go to a cancer center. Um, and then you will find yourself paying more money because let's just say you need physical therapy. Well, the health plan, your Medicare Advantage plan might say, okay, you can have 5 sessions, but the doctor says you need 21 sessions. In original Medicare, you can get all 21 sessions. In Medicare Advantage, you'll be paying for the other 16 all on your own. So what is happening here? And I didn't think about this with Dr. Oz assuming becoming the administrator of CMS, but I didn't want Dr. Oz because Dr. Oz wants Medicare Advantage for all, not just seniors, for all. So he wants a socialized healthcare system in America that runs like Medicare Advantage. So everybody in a health plan, everything running like Medicare Advantage. And so I think what we're seeing here, because he's now in charge of Medicare, is that he has decided that he's going to bring Medicare Advantage into original Medicare. He's going to bring the prior authorization and all the controls of Medicare Advantage into original Medicare. And so for the people in those 6 states, which if you're going to ask me what the 6 states are, I think I should have had the list. I know Arizona is one of them, but it's easy to look up. Just look up 6 states new Medicare project and you'll find it, or you can certainly contact us. But I think we even have a press release on this. But anyway, in those, people are going to run into this. And in those states, people are going to be paying a higher price for original Medicare, but they will be getting the lower quality Medicare Advantage treatment. We don't know what the degree will be. We do know that the government is contracting with some third-party entity that will be doing the prior authorization. They could even be using artificial intelligence, AI, to decide what you can and cannot have. This is coming within the health plans. And so this is serious because what you can tell here is that they have decided that all Medicare patients need to have their care rationed through prior authorization approved by the government. And so the if they get their way, the freedom version of Medicare is going away. This is just one more reason why our bill, which we have Gary Palmer in the House and Ted Cruz in the Senate, our bill is called the Retirement Freedom Act, and it gives seniors the right to opt out of Medicare without losing their Social Security benefits. This is also why our bill, which we call Make Health Insurance Real Again, it almost had an author, but then that person is going for another position and so can't do it anymore. Make Health Insurance Real Again would make catastrophic medical indemnity policies available to all Americans at any age. These two combined would free Medicare from what's coming, would make it more affordable, patient-centered, get all the third parties out of the exam room, take away all the money that's costing you as a patient, and stop controlling the doctors and keeping them from doing what they need to do, and really causing them to leave the practice of medicine early because they're done with it. They are fed up with all the bureaucrats telling them what they can and cannot do, paying them, not paying them. I got a story about not payment if we've got time, but I'll leave it at that.
Well, let me just, before you go into that, and I'd like to hear the story, I have a comment and a question. The comment is, didn't they just have a hearing on the predetermination stuff, on the pre-approval stuff? I mean, I actually saw it online. This is, well, I don't know, September, October, something like that, where they said that all of the, what physicians hate more than anything is this pre-approval process. A person needs a hip replacement and they have to, the x-rays are terrible and all that stuff, but they have to get it pre-approved and that can take a long time. And there's
Mhm.
also been problems with the pre-approval, like for cancer care, that people get precipitously worse or they even die before
Mhm.
some bureaucratic 23-year-old somebody sitting behind a desk is making some sort of a determination of whether we're going to pay for this or not. I thought that they had resolved that.
Oh, I don't think that's resolved. I think that was just a hearing to look like they were doing something.
Ah,
I don't feel like there's been any resolution to that whatsoever. I think they're buckling down on that because if you look at the Medicare financial situation, it's what is it? Eight
no,
years?
yeah,
7 years.
it's
7 years. It's 2033 when they expect to have only be able to pay 89% of all the bills that come in. And for your listeners who think, oh, okay, it's only 11% that they won't be able to pay. I'll just bring you the example from 2022. So I did the calculation. In 2022, the total cost of Medicare was $905 billion. If they weren't able to pay 11% of the bills, that was $99 billion that they would not be able to pay. Now, is that your care, my care, whoever's care, right? Whose care is that? That is going to either not be available or they're not going to pay the doctors. And then the doctors say to themselves, well, I'm just not even going to offer this procedure anymore because they're not going to pay me for it. Or is it like some people get the care and other people don't? And if you're more privileged, if you're more status, Congress gets the care, whatever it is, somebody's going to eat that cost. And it's not going to be the government. The government's just not going to give out as much money for care. And then everybody else is going to have to figure out, well, what do we do here? Do we let people die earlier? Do we not give them end of life comfort care? What do we do? You know? So
well,
this is no small thing. We have to free people from Medicare.
well, and then the and then the other thing that happened with Medicare Advantage, it was one of the links that you sent me, is that you reported that at least 33 hospital systems, not 33 individual hospitals, but hospital systems, like here in Cleveland, where I live, the Cleveland Clinic has, I think, 8 or 10 hospitals in the area that's in their system.
Right.
33 hospital systems are dropping Medicare Advantage, which
Mhm.
two questions from that is, why are they doing that? And what happens if some unsuspecting senior has Medicare Advantage and falls down and breaks a hip or breaks an arm or has chest pain or something like that and goes to that hospital and they aren't accepting their Medicare Advantage? Will the senior know that in advance? And if they don't, what happens then to
Mhm.
payments and things like that?
Right. So we're ending up with conundrums here that patients don't have any idea about. They think that they're protected. They think Medicare is there for them. They're good to go, right? But the fact of the matter is, and I think, maybe as just a slight iteration of what you said, like the Mayo Clinic, for example, they are not accepting most Medicare Advantage plans, I think is the term that they used. But it's like big ones, like United Health Group, they're or United Healthcare. They've dropped them. So I'm not sure to the extent that these 33 systems have dropped every Medicare Advantage plan or just most of them. And in this case, I believe that Mayo dropped most of them. But nonetheless, to answer your question about, you think you can go anywhere. Where most people in Medicare Advantage, so this has always been the thing with Medicare Advantage, because if you're in Medicare Advantage, you have a network. You have a network, and everybody knows they have a network. Now, whether they check their network to see if it changed year to year and whether they thought they could go, but that's one of the things that Medicare agents try to help seniors with is figuring out, well, do you still have access to the doctors that you thought you had access to or that you had access to last year? How did that change? It's something for seniors to track. And seniors may or may not be terribly good about tracking this kind of thing. So they could find themselves caught. They could find themselves in out-of-network care or the cost of out-of-network care. It's also possible that there are stipulations of emergency care and that things get paid for when it's truly an emergency, like you have a heart attack, you have, the fracture that you're talking about, all of that. There's probably something in there about emergency care, and it might be then a consideration between the plan and the facility as to how that will be handled,
It's just a big mess.
or whether you have to be transferred as soon as you're out of the emergency state of your condition.
Yeah, so this is it's just more of big medicine mess, which is
Mhm.
a good place for us to take a quick break here and hold that thought because it's just kind of mind-boggling. So we're going to take a short break and hear from our sponsors at AmericaOutloud.news. America Out Loud Talk Radio plays the Tenpenny Files on iHeartRadio Monday through Friday at 3 p.m. Eastern. You can also find them by going to AmericaOutloud.news. Click on the podcast tab. You can scroll down and find my icon. It's got my picture on it, and you can see all the past episodes that we've had. And then if you've missed it there, you can also find it on any of the podcast platforms that you subscribe to, such as Spotify, Pandora, Apple, TuneIn, iHeart Virtual Studio, and you can find it at drtenpenny.com, drtenpenny.substack.com. We also post them on X, Instagram, and on Rumble. Just follow me at Busy Dr. T. There's so many great books and so many documentaries and so many great conversations that we hope that this show will jumpstart your interest and save you some time. We're going to take a quick break, hear from our sponsors. Please listen closely. We've got more to come with Twila Brase from Citizens Council on Health Freedom. We got some updates on Real ID that you need to hear about. We're going to talk about that when we're right back.
Zeolite is a detox spray. We work specifically with a company called Touchstone Essentials. They are an incredible company. We've been working with them now for several years. And zeolite is a mineral that goes through your body like a one-way basket. It will clean out heavy metals such as arsenic and mercury, aluminum, cadmium, and it hooks onto those metals from a one-way perspective. So once it's bound, it goes out through your urine or your stools and doesn't get redeposited in other places. Everybody needs to have a detox product in their life, and this one is so easy to use and it's so safe. You can take it when you're pregnant, you can take it when you're nursing, you can give it to little children, you can even give it to infants, and quite frankly, I give it to my dog. I actually put a little bit of the zeolite in his water because until we all stop living in a toxic world, we all need to get some of those extra toxicities out. The heavy metals, the persistent organic pollutants, the things that are floating through the air, the different things that we come in touch with in our environment. And we are a big fan of zeolite from Touchstone Essentials. We've been a big fan of their products for several years. Go to drtenpenny.com/detox to get your first bottle of zeolite spray for $50 off.
Well, only when the government bows to the people will America become great again. This is Malcolm Out Loud here. Join me in pushing back against censorship, my fellow Americans. Right at the top of AmericaOutloud.news are the words, many voices, one freedom, united in the First Amendment. Now is our time, my fellow Americans. AmericaOutloud.news, liberty and justice for all.
Oh, welcome back, everyone. You're listening to the Tenpenny Files, and today our great guest, a monthly guest that we have is Twila Brase, that is bringing us here a monthly update on critical updates on healthcare, Medicare Advantage, and we're going to talk a little bit about the Real ID and some updates we have to that. But just as a follow-up for our discussion that we were having before the break about Medicare lack of payment, because I think that a lot of people that have Medicare and Medicaid They think that their little card that they have when they walk into a doctor's office or a hospital system, they think it's just like a credit card. And if their bill is $5,000, they just swipe it and the hospital gets paid $5,000. And that is simply not true. You've got a story to tell us about that, Twyla.
Yes, I have a story about Medicaid. So I was in a panel discussion and there was a doctor sitting right next to me, and some people in the audience were wondering about Medicaid because we hadn't really touched on the topic. And he said, "Well, let me tell you a story." He said, "You want to hear about Medicaid? So here." He said, "I was sitting with a Medicaid patient for 45 minutes. I had a 45-minute appointment with her. And then I sent the bill. And then several weeks later, I got the reimbursement, and I opened the check, and I opened the envelope and I pulled out the check, and it was a check for 32 cents.
Oh my gosh.
32 cents. And he said, I would just have soon have given that woman that time and attention charitably rather than to be insulted with a check for 32 cents. And when you think about 32 cents, not only is it outrageous, right? But the stamp,
Hmm.
the stamp to send it was twice as much as he got. And
Wow.
then even the money and the time it takes to send a bill. Years ago, I heard it was $25, which probably means it's $50 today. Um, but so he got 32 cents not only for his time, right, to cover his time, but to cover the billing, to cover the stamp, right? It didn't cover anything. And people don't understand that. And then if you're in Medicare and you look at your EOB and you see several things, right? You see what was charged, you see what Medicare approves to have been charged, then you see what Medicare pays, and then you see what is your responsibility. And so this is kind of a gaming system that is in place, because if doctors probably charge the amount that they really needed, they would get so much less. So they have to charge even more so that the amount that Medicare approved is at least within and not even reasonable, but at least starts to cover, the expenses. And then they get the amount that Medicare actually covers, which is less than what Medicare considers reasonable. And then they attack on the $10, $17, $32, whatever that the patient pays afterwards. And this is if you have a supplemental policy. That's what you will get with original Medicare and supplemental policy. I just told you the scenario there. And you should see those and you should look at those. And you should see, what if you were asked to pay the amount that Medicare pays? And what if you were asked to pay the amount that Medicare actually pays? How affordable would it be for you? Now imagine an entire healthcare system that didn't have all the third-party payers. The government wasn't involved at all. And that's what you were asked to pay. And they could deal with it. They could deal with that amount because they didn't have to deal with all the rest of the paperwork. They're dealing with it now in the Medicare system and trying to figure out how to make it up money with something else. The entire system is turned on its head because it's not a cash-based system. It's not a real insurance system. And so we got all of this stuff happening. But when you look at the prices that Medicare pays and you know that doctors will accept them, and then realize that Medicaid pays even less, now we can start to see what healthcare would really cost and how much easier it would be for hospitals and doctors to exist independently if all the third parties were out and you were paying that amount of money and you had a true catastrophic policy for the true catastrophes, where you just had to pay those smaller amounts of money, but lots of time over the time of your catastrophe. Then we can see what the real cost is. Today's cost is nowhere near what the real cost of a cash-based true insurance system would cost.
And another thing from a physician's perspective, and what happens in your office is every year they change the rates. They change what they are willing to pay. And just to give an example, let's just say for just regular office visit, there are 5 different codes that you submit to get reimbursed for an office visit. And every year with Medicare patients, the amount that they're willing to pay you to reimburse that changes, and it's always less, but they never tell you what they're going to pay. And so what you have to do, it's like the first quarter of the year, it's a guessing game. It's like, okay, last year I submitted $100 for this office visit. So you submit it again and they'll say, and they pay 100% of it. It's like, oh, well, then their reimbursement is really higher than that. So the next time I send it in, I'll send it at $125, that they only pay 90%. So then you sort of figure out, well, maybe I guess the real number is $117. I mean, this is the kind of nonsense that goes on in your doctor's office that accept Medicare. And it's why they have to have, a 3 or 4 other full-time employees that do nothing to generate money for the business. All they are doing is playing games with it, with the insurance companies, because that's not only true for Medicare, it's true for Medicaid, it's true for United Healthcare, Blue Cross Blue Shield, for, all the rest of them. It's a big kind of guessing game, because they don't just come out with a new sheet and say, okay, this year, this is how much we're going to reimburse, and now you start doing that. And now think about what you said about stamps, because every time there's this guessing game and you have to resubmit, you either have to do it electronically, which costs money, or you have to send it by mail, which costs now almost 70 cents a stamp to sort of send that in. It's just nonsense. So what you're suggesting about a real healthcare plan is really just spot on, Twila.
Yeah, we call it our 3C solution, or our 3C initiative. So cash, catastrophic coverage, and charity. And the thing is, people should not look askance at charity. The mission of medicine medicine has always been a mission, and it's always taken care of people who needed charity. They just couldn't afford it. And Medicaid is not charitable. Medicaid is coercive. So don't look at Medicaid like this is the answer. Medicaid is also, I would say, fraudulent. This is one of the cash cows for the health plans, because they get paid per member per month a certain amount. And then they can deny those people access to care. So they can just keep this money. Imagine if hospitals and doctors, et cetera, all just had a whole charity program for those who really couldn't afford it. And that is like the cheapest way to give care, because there's nobody involved at all. But it's also where you get patient gratitude. In Medicaid, there is entitlement. Like, I deserve this. This is mine. You have to give it to me, whatever, right? I dealt with that in the emergency room. They'd come into the emergency room on Medicaid. I'd get them into a room, take all the vitals on the child, and then the family would basically, one person would stay with the child in the room, and the rest of the family would go down to the vending machines, and they'd, buy all sorts of things and bring them back and sit there in the room and snack. Now, what if they had to pay that amount of money just to get into the ER, right? That would be good. That would be good to help them, to get us to the cash base and get us to the gratitude. But we could also just give charitably to those who really didn't need it. And that really brings gratitude. But it also means that people wouldn't come in for frivolous things, because they'd know this was going to be given charitably. But if they really had to, they'd also know that there was a charitable impulse alive at the doctor's office, alive at the hospital. So the 3C solution, cash, catastrophic coverage, and charity, is our way to bring back the entire healthcare system. And this year and next year, we're really going to figure this out to advance this, because this is where we have to go. Otherwise, it's socialized medicine for all, run by the health plans.
I remember that back in the day when I was an ER doc and in the ER, and people would come in at the end of the month. There would be this influx of people coming in to the ER for really frivolous reasons. I'll never forget the one who I went into the room that was waiting for him. Why are you here? I got this little red dot on the back of my hand. And can you tell me what it is? Does it hurt? Does it itch? Did it just show? No, I had 6 more visits on my card this month. So this was really bothering me. So I thought I'd come in and ask you. These are the kinds of things, and you worked in the ER too, the kind of things that you would see. And it was, I remember working in a kind of an inner city ER at one point in time, and you'd see this influx of parents bring in their baby and their 3-year-old, that there was nothing wrong with them, but they'd be coming in at 2 o'clock in the morning because it was on their health plan, and that they were still getting this. And the frivolousness of that is just, crazy. And the entitlement. And when you say about charity, back in the day when doctors had their own office, particularly in smaller towns, and people couldn't pay, they would barter. And somebody would bring them in a pie or a chicken, or it was a big expense. They'd offer to paint their house or paint their kitchen, or if they were a plumber to fix something. And so there was an exchange of services, but with a level of gratitude. Thank you for taking care of me. And this is the way that I have to pay you back, is by doing something in a barter situation. And they have tried to do everything they can to remove that element of the care, of the charity care.
And this is why I say the mission of medicine has been taken over by the business of healthcare,
Yep.
right? They don't want the charitable impulse. This is all about just being a cold-hearted, in-out conveyor belt. There's production quotas for doctors these days. There's all of this stuff. You get 5 minutes a patient. You can't even figure out what's wrong with the patient in 5 minutes. But you can prescribe them a medication that they probably shouldn't have or probably don't need if you just got to know them a little bit better. So we do need to get back to a real healthcare system that is patient-centered, confidential, affordable, all the things that anybody wants when they are a patient, and all the things that I think every doctor wants to be part of, right? Where they can go home, sleep at night, feel like they did their best for their patients, got to know them, all of that sort of thing. Just didn't run them through a conveyor belt to just get a certain number of patients done in a day.
Yeah, for sure. Yeah, that's why a lot of doctors are leaving the practice of medicine. Even younger doctors in their 30s and 40s are totally dissatisfied. They're thinking, this isn't what I signed up for. This isn't what I went $400,000 in debt to get this education for. This isn't what I thought I was going to be doing. So it's a big conundrum. I hope it gets changed. But I want
Well,
to,
and I would just say about that is that patients are like, oh, okay, well, they have to leave, and it's no big deal. Every doctor that leaves patients behind, and leaves means that there will be more hours, more days, perhaps more weeks before you can see a doctor. So it's not a small thing to have doctors take themselves and their critical thinking brain and all of their skills and all their expertise and leave because they can't stand what the system has become. It's a big deal.
It really is a big deal. And speaking of a big deal, I want to move on to something that's a really, really big deal. And you've been at the forefront of this for months now, maybe even longer, about Real ID. And we've talked about Real ID on this show quite a few times. And as of February 1st, there's now a federal government coercive monetary penalty for noncompliance. And I just keep wondering, how far is that going to back off TSA, which is already crazy because more people sometimes are in the pre-check line than they are in the regular line. And if they don't have that ID, and who's going to run that credit card? Is it going to be when you check your bags? But what if you don't have bags to check and you just have a carry-on? Is somebody at TSA at the pre-check line, are they going to have a credit card terminal that they're going to run? Because now they are coercively charging $45 per person if you don't have a real ID. And yes, recently DHS, Department of Health and Human Services, has come out and said that real ID is not even a proof of citizenship.
Mm-hmm.
That was just the most recent thing that they came up with. So what's the point? They're going to make airline travel even more difficult. They're going to make it impossible for some people because if you go to the airport and you don't happen to have $45 in your pocket or a credit card that's got limit on it, and you don't have a real ID, which isn't a proof of citizenship, what's the point of all this, Twila?
Well, I think, February 1st is going to be an interesting day. They are trying to soften the blow by, if you go to tsa.gov, you can see that there is a place now where you can pay your fine. I would call it a fine. They call it a fee, but this is really a penalty. This is like I wouldn't call it quite their last ditch effort to get everybody to submit and, comply with this violation of their 10th Amendment rights, their Fourth Amendment rights, the whole kit and caboodle, right? But this is what they're trying to do to get everybody into a real ID. They want you to feel the pain. And maybe as a thing to just make sure people that didn't misunderstand what you said. So you said if you come without a real ID, you're going to have to pay $45. They It's interesting that that's kind of what they said in the headline of their press release. But if you read a little bit further down, you can see where they say or other acceptable IDs, such as a passport or passport card. There are a total of 16 different acceptable IDs, although the TSA now has this little caveat on the top of them, which says check back often because the list may change. All of this is meant to get you to conform and submit. So when it comes to this $45 fee, I think a little history is important. The regulation that came out in January 2025 said that they were going to begin progressive enforcement to get everybody into the Real ID. That rule really was all about the airports because they were so worried as to what was going to happen at the airport. So they gave it 2 years. Progressive enforcement over the next 2 years, ending on May 5th, 2027. And so this is part of their progressive enforcement strategy. They have 44% of Americans' cards that are not Real ID compliant, and they want it to be 100% of cards that are Real ID compliant, even though it's a complete violation, and even though it's a federal takeover of identification, and even though. So I could say some of the things, right, that this is doing. But so they came out with this notice 5 days before the busiest travel day of the year, so 5 days before Thanksgiving. And they said there'll be this new modernized identity verification system, and it's going to cost $20. Then I think it was December 12th, maybe, that they came out with a press release. And this press release said that it's going to be $45, and they had a name for it. TSA Confirm.ID is what it's called. And now they claim that they have authority to do this because there is a law that gives them the right to create traveler programs. But let's just look at the other two traveler programs, and you'll understand why this is a penalty, not a fee. So the other two traveler programs are Global Entry, which costs about $120 and is good for 5 years. TSA PreCheck costs about $80 and it's good for 5 years. $80, right? This little program that they got started here costs $45 and it's good for 10 travel days. 10 travel days. So unless they have defined, which I haven't seen, that they have defined 10 travel days to be 10 times in and out of the airport. But no, I do believe this is 10 days that you are traveling. And so that if you have a 2-week trip, you will be paying coming and going. But you'll not only be paying coming and going, you will have to go through their biometric screening and their biographical screening. And they say, we cannot guarantee that you will make your flight. So this is another thing where they're trying to convince you that you should just comply. This is pain, right? Threats, pain, all of this stuff, because they want everybody into the Real ID, this federal identification system that is completely unconstitutional. So on February 1st, right now, I would encourage everybody to go get your passport and get a passport card at the very same time. Our organization's leading the charge to stop the Real ID. We're going to attorneys general. We've contacted Trump. We're going to state legislators. We're working with about 10 legislators in about 10 states now on legislation to completely put a kibosh on this and upset the apple cart. And we're asking people to refuse the Real ID and to go back to a state driver's license if they already have a Real ID. And some states allow it and some states don't, which you can find at our special website, refuserealid.org. You can find actually a map. And it's brand new as of like 2 days ago, where we now have 2 maps. One map for the people who made the switch successfully. And that's the green map. And then the second map for those people who tried to make the switch and weren't allowed to. And the interesting thing about those two maps is that there are people on each map. So let's just say, we'll just pick Minnesota, and I'm not looking at it, right? But let's just say Minnesota, that a lot of people have registered that they made the switch. And I can't remember, but there might be some people that have registered that they weren't allowed to make the switch. Well, in Minnesota, you are allowed your choice of whichever one you want. So there was some rogue DMV that said, sorry, we're not going to let you do it. And so that's what we got here is a problem with rogue DMVs. But everybody should get a passport card, get rid of the real ID, refuse the real ID if you don't already have one, and work with us to help thwart the system. Contact Senator Rand Paul's office. He's got the bill to repeal real ID. I hope he's serious. He's chair of Homeland Security. He could just cut the legs out from under the real ID if he wants to. And but we haven't seen any movement after the bill got introduced, and we want to see movement. He was on Joe Rogan. He never even mentioned the real ID.
Wow.
So, so he needs more people thanking him. Thank him for the real ID bill, and then say, please hold a hearing. People don't understand what real ID is, and we don't want to have, a totalitarian system in this country. We don't want to have a Chinese social credit system in this country, because the real ID is going to be digitized. It has your biometrics, your face. That's biometric control, just like in China. And then it can be expanded to anything in life that the Secretary of Homeland Security decides. So we got a real problem on our hands, and we have to have the people to tell legislators, state legislators, tell their governor, tell Trump. There are phone numbers. Just look up phone number White House, and you'll find two phone numbers, and they are live. You can leave a message on the one, which is comments, and you can talk to somebody in the switchboard on the other one. So, do what you can, but take action as we try to stop this. And in the meantime, try very hard not to pay the penalty at the airport, but tell us all about it. Go to refuserealid.org. Tell us what happened, how the process worked for you. We would love to know what's happening on the ground. And so we need people to let us know.
Well, Twila, again, this has been a great amount of wonderful information that's so important to our listeners, and we're going to run out of time to talk about all the other things that we had on the slate to talk about today. But I will say make one quick comment before we close out here. I was at the post office on Wednesday this week because I had a bunch of things I needed to send out. They were boxes. And when I walked in the door, and it's a small post office, but it's very busy. I mean, it's a really busy post office. And there were 6 people standing in line with passport applications. And I've never seen that before, ever, in this little post office where I live. They were really busy. The gal was just beside herself because she said, like, next, oh, you're another passport, and next. And so she would go to the other thing. So I think people are listening to you, and they're getting it, and they're wanting to do this stuff with this federal ID. So with everything, again, it's just so amazing. Tell people, you've got about 10 seconds. Tell people what your website is so that they can follow up with the 2 websites that you mentioned.
One is cchfreedom.org, cchfreedom.org, and the other is refuserealid.org, refuserealid.org.
Well, everybody listening to this needs to pull up those websites and tab them, mark them, and go back there regularly because there's such great things there. So with that, we're going to close out for today. We're going to see you tomorrow or the next time at 3 p.m. Eastern on AmericaOutloud.news and iHeartRadio. You can follow up with us at dr10penny.com over the podcast tab. And we've got such great guests that we've got lined up for you here in the next month or so, and even beyond that. So have a great rest of your day, everybody. We will see you again here tomorrow or the next time on the Tenpenny Files. Goodbye and God bless.